So thank you again for being here. And Marisho, it's a pleasure to have you with us. I like to start our conversation by just asking you to tell us how you got involved with the association with Action Dignity, and also how the cultural brokering, your cultural brokering work came about. So do you want to start with that then? Again, thank you for being with us here today.
Okay, thank you. Thank you, Sarah. It's a pleasure, actually. You know, I discovered about the national network of community health workers through the Pathways to Prosperity conference. I tried to get into your workshops, and then I said, oh, this is a great national organization to be part of, because we've always been in Calgary and our closest partner is the Edmonton Multicultural Health Brokers. We've been working with the past 25 years, imagine, even before we started the Action Dignity. So it's really a pleasure. We are very interested in being part of a national network because we know that we will be learning a lot from you. And I'm really honored to share our experience here in Calgary. Okay, so I was asked to talk about cultural broker strategy and how we're doing civic participation and integration of ethnocultural communities. But I also thought that I will focus on applying cultural brokering on our COVID-19 response. But I will give you an overview of the range of cultural brokering work that we are doing right now. So the outline, I thought that I'd give you an outline of what Action Dignity is first, a little bit of a background, and the community broker model. I just want to let you know that this model in Calgary was chosen as one of the most promising practices in Canada for settlement work and integration. In 2020, we had an evaluation that several evaluations of our broker strategy that are documented that we can also share with you, and is also in the Pathways to Prosperity website with a video presentation. Then I'll talk about cultural brokering during the pandemic after I give you an overview of our overall work, and then some of our experiences, lessons, and potentially stories. Please let me know if I have. Can you give me around 5 minutes before I have to stop so that I can skip some of the slides and
Sound great. So I'll give you in about 25 minutes then. We'll see.
yeah, and so that we'll have more time for discussion.
Thank you.
So first, what is Action Dignity? You will see here a photo of some of our community leaders and community members. We do a lot of community events, but we are actually, as mentioned by Sarah a while ago, we are a platform organization. We used to be an umbrella organization, and our old name was Ethnocultural Council of Calgary. So we have over 110 member organizations from different culturally diverse communities. And we have organizations as members, as well as over 100 individuals. We were founded in 2002 officially, but we were formed as a result of the racism that was been happening here in Calgary. And we had a session around year 2000 when racism was not really an issue that's being discussed in the open, and our organization is based on that. And so after a few months, we were founded in we had a launch in March. It was the International Day for the Elimination of Racial Discrimination in 2002, until we were registered as a society and became a charitable organization. So that's our background, and our mission right now is that we facilitate the collective voice of ethnocultural communities towards full civic participation and integration. Please note here that our role is to facilitate the collective voice. So that explains how we have designed our work at Action Dignity, and we do a lot of collaboration among different cultural groups and with the broader society. So, our areas of work, you will notice here that we are not a direct service provider organization. We do not do direct service, but we do a lot of capacity building. We train leaders and strengthen organizations. We also do a lot of public awareness on issues, especially the root causes of the problems that confront ethnocultural communities. Public awareness and education, we highlight the important role of ethnocultural communities and racialized communities in our society, and promote full civic participation. So we facilitate discussions with decision makers, even with ministers, with policymakers, with public institutions. So we try as much as possible to have these voices and create opportunities for these voices to be heard. Now, I tried to look at what is the history of cultural brokering really? When did it really start as a concept? And I found out that in the 1950s and the 1960s, this is the era when decolonization was happening and there was a rise of nation states. National independence movements was on the rise, and there was a lot of talk around shifting political authority from the colonizers to the local leaders. And of course, there were the elite leaders there who were vying for authority. But what is important when this cultural brokering model was came into in the forefront of being discussed was the if you will look here at the last bullet, the relations of local communities with larger systems and decision makers. There was a lot of talk around how will the local communities access systems and services, how will the local communities be part of decision making, informing, in shifting these forms of political authority. There was a lot of issue in discussing inequity, inequality, and systems and service navigation. This is interestingly where the cultural brokering model started, and there were anthropologists and sociologists who came up with several theories. But when I looked at the definitions, I saw two types of definitions. One was the role of cultural brokers in bridging, linking, mediating, reducing conflict, or producing change based on the situation that I just described earlier, in addressing all the inequities that are happening at the national level of the different nation states. But I think one of the qualitative definitions too that we are very much associated with at Action Dignity is advocating for social change to address inequities. And this is where we look at the role of social transformation, social change, addressing the root causes of problems and not just the manifestations of these issues. And so we are in the process of Action Dignity of looking at how can we better define our role in Calgary and in Canada. And we came up with, let's explore our role in fueling equity. So Action Dignity is not the super saver or the lifesaver here, but we fuel. We try to look at the different key players that will work towards an equitable society. And I think this is where the role of the brokers will come into play. That we are not just looking at the immediate problems of society, of the community, but we are also looking at how can brokers play a role in addressing the root causes and the systemic issues behind this inequity that's happening. And so based on that, we looked at how do we how do we identify the attributes of a cultural broker. You will see here two types of definitions, one in purple and one in green. The one in purple are the things that we cannot um, develop among brokers. I think these are the qualities that they already have when we see them. They are the insiders who grasp the values, the language, the beliefs, and practices of the cultural community. They are deeply embedded. They know, they feel for the community. They are trusted, they are respected, and they are well connected to the different networks of the community. Sometimes we call them the eyes, the ears, and the soul, or they feel for the community. So they have that, connection that makes them very effective in the community. But there are also areas of work that they need to be honed with, or they should know about. And this is where action dignity comes into play in terms of the training. These brokers, the fact that they are insiders, if armed with knowledge and skills and experience in dealing with systems that cause the inequities of society, if they are able to know what are the knowledges, how do they navigate the systems, what are the skills they need to be effective in bringing these communities to the systems players and decision makers, that will make them more effective in their role of addressing the issues of equity. So you will see here that these are the areas of training that we have been focusing on. Um, while, of course, helping them becoming more effective in engaging and in raising awareness in their communities. So we also came up with, so how do we design the roles of community brokers? The most common here is this, the cultural liaison and guide. They connect. They connect them to resources, they connect them to decision makers. And sometimes they also play a role of mediator or co-creator, we call it, where we also connect them with other cultural groups. So if there are issues common to them and the other ethnocultural communities, we help them come together, co-create, and sometimes they come up with community action plans to address some of the issues that are confronting the community across different cultural groups. We also do sometimes connect them with service provider organizations where they can also co-create with these organizations. We also see them as catalysts for change, where they can come up with lasting solutions or innovations that even the government cannot think of, because a lot of solutions out there are are naturally coming from the communities, because the starting point here is that people with lived experiences come up with really important ideas for change that are effective in the community, and that is the role that we really want to enhance. And of course, being advocates too is very important. An example here is that we have essential workers advocates that come together, where brokers play a really important role. Advocacy for policy change, advocacy for changing specific ways of how, for example, public institutions operate, like the Alberta Health System, for example. So, what are the necessary skills that will enhance the role of cultural brokers? We have defined community empowerment as a very important direction that cultural brokers need to do. And you will see here that the role of education and outreach is very important among community members. Organizing, you will see here the big fish catching the small fish, but if we only organize our communities, we can address big picture issues here and have a greater role in decision making. So organizing is one of the important things that we need to do, because if people are scattered, or each will have his or her own way of doing things, their own way of doing things, then we're not we're not going to be as strong. And of course, community action and engagement. And this is where community action planning as a skill also comes into play. So these are the different areas of training that we also provide for communities. Now, what kind of impact do we want to create? There are three levels of impact here. If you start with the individuals and communities, so we see a lot of this, for example, in the child welfare system, right? The brokers play a key role in that. Building the natural supports among family members, addressing access, individual access, family access, their participation, and all these immediate issues, including COVID, right? Addressing COVID. But we also have an impact. We also want to create an impact in the community, where communities are usually being seen as not playing a key role in addressing important issues. So we do a lot of work in building the natural support systems networks. For example, in addressing domestic violence prevention, we just don't rely on sorry, formal individual service provision, but also community. Sorry, I have to breathe. So, public engagement of communities, communities playing a key role in having a collective voice on issues is also very important. But also at the systems level, we address the issues of among public institutions, the public policies that impinge on the rights of racialized communities. And so elaborating on the systems change, there are three types that we have identified: public institutions like the health system or the workplace system, service systems, even service provider systems need to be more accessible and adaptive to the needs of these communities, and also public policy change at the federal, provincial, and municipal levels. So in going back to this one, the levels of change that I mentioned, the individual, community, and systems. At Action Dignity, we started looking at where do we want to create an impact on the systems change. There are there are broker work that just to focus on individuals and families, which is fine. But there are also brokers who focus on individuals, families, and communities doing community prevention work. There's also broker work that focus on individuals and families, but also do community and systems level change, look at policies. But there's broker work that focus on community prevention, systems level change, but also try to impact on individuals and families. And there is a type of broker work that focus on systems and public policy change, doing work on the community and also doing work with individuals and families. And these approaches would vary depending on how the organization or the community would like to play a role in. And what helps is a diversity of these different approaches that complement each other and strengthen and support each other. In our case, we have been looking at because we don't do direct service provision, right? We right now we are focusing more on community, highlighting the role of community prevention, but also doing work on systems change, and also trying to do more work on public policy and systems change work. What are the different types of broker strategy that we have done so far at Action Dignity? This is just a few of what we have done so far. We have brokers who focus on anti-racism work. We have historically and for a long time, we had brokers focusing on older adults. We had, in fact, 15 um, we call them older adult brokers who worked with the different language groups and were doing work on social isolation issues, service provider systems, and also some work on public policy change, especially when they were dealing with the city council on different issues. We also have workers' rights advocacy issues that our brokers are dealing with, especially the essential workers and the migrant workers. And this is more focusing on public policies and workplace situations. We also have brokers who focus on healthy relationships and domestic violence prevention, as well as brokers who looked at the person-centered care strategy and strengthening the ethnocultural equity lens. So in all of this work, we were working towards racial equity, whether in the workplace, in the communities, in the families, and in the health system. Now, applying this in the pandemic era, we we were involved naturally because of our connections in two outbreak areas in Calgary. One was in the Cargill meat packing plant, where there are 2,300 workers, 95% of which are racialized, and in Calgary Northeast, which is also predominantly racialized communities. And you will see here in the map that we had over 1,400 positive cases that was increasing at that time to 200 per day. The same with the Cargill meat plant, where 1,500 community members were infected, 900 of which are workers in the meat plant. So in December, we formed a collaborative, although we were involved in early May, in early April in Cargill. But we had three objectives with a collaborative that we are with right now, and this is comprised of 17 organizations. One is the um, immediate relief and support to COVID, community-based prevention, and addressing the root causes and the barriers that are affecting the workers. Sorry, it's already 11:30. I didn't realize that. But I'll just explain to you the model that we did. For example, so we have the cultural brokers. This is Sokwan, who's one of the participants here. We had 19 cultural brokers who were receiving phone phone calls from residents who are in isolation. So we established a hotline. This is one of our innovations of Action Dignity, where people can call and then they can be connected to 19 cultural brokers who spoke 22 different languages. And so, how did we get the callers in? The Northeast communities in Calgary, ethnocultural organizations, faith communities, businesses, ethnic media. And this is the outreach work that the brokers did. And a few coming from Alberta Health Services, but mainly the referrals are coming from the communities themselves. And then the brokers would enter the data. We had a database system into a database triage that's handled by one of the immigrant serving agencies, and then it would refer people to for food, financial support, mental health to two other immigrant serving agencies. So the direct service provision is through immigrant serving agencies. And then we had our other partners who were also helping with the needs that we farmed them out here. So this is how we formed the Calgary East Zone Newcomers Collaborative with the Calgary Local Immigration Partnership as another partner, as well as our three government levels of government, the city, the province, and IRCC. So this is the whole network of support that we had for COVID response, with the brokers playing a key role in dealing with residents. These are the language groups that we have. And this is a photo of our different cultural brokers. They're operating everything from their own homes and answering all calls. There was a time when we were open Monday to Sunday, 7 days a week, from 8 a.m. to 9 p.m. during the peak of the pandemic. And this is how we received our calls. See, there was a week where we received over 800 calls in 1 week. These are the weekly calls. And this was the time when the outbreak leveled off. So we also had an impact on the communities, and you will see here that we had received 3,800 calls so far as of May 12, yesterday. And if you multiply this by 4.3, that's the number of individuals that we have served per family member. We also are able to monitor the regions where they're coming from: Southeast Asian, African, South Asian, Middle Eastern. And this is a reflection of the number of racialized workers that are being hit by the COVID. And by language group too, we were able to see the Filipinos comprise almost 50%. We had Chinese, Vietnamese, Arabic, Persian, Spanish, Punjabi, and several African languages here, Amharic, Tigrinya, etc. The food was the number one need. So these are all the needs based on the percentage. 98, 95% needed food, financial assistance, employment. We were able to gather all these statistics. But this is also an important a set of issues that were identified through the workers being, in conversation with those who are impacted by COVID. A set of financial burdens, employment loss, lack of income, reduced working hours, difficulty paying bills, family related factors, loss of family, single parents, family responsibilities, living conditions, crowded homes, isolation of seniors, and then the physical barriers, being sick, disabled, especially the long haulers now who cannot even go back to their work. We had several stories that maybe our brokers can talk about later, but stories, very sad stories, where the brother, the mother were laid off, they couldn't pay any rent. Um, the, the several other like a family of 10 share a small space among each other, or one client wanting to go to an isolation hotel was denied. We even had families, because this was during the winter, who did not have a place to go, and they were being turned away by the housing accommodation. So brokers had to advocate on their behalf until they are let in and given a home during the winter times. We had several success stories where um, the workers were so afraid of going back to work. They didn't feel safe. They were afraid they were going to be laid off. So brokers advocating for them, and the HR manager agreeing that they should not go back to work if they don't feel safe. And also issues of hospital expenses. We had community members who were being charged $11,000 a day for isolation, when in the period of pandemic they should be free, and they were granted free hospitalization. So they were quite relieved when our community members advocated for them. I'll stop there. I still have many other things to share, like our role in engaging communities, how many organizations we have reached out to, how many leaders, faith leaders, how did we do awareness and education through the videos, our community meetings with leaders that spoke different languages, and we also are playing now a role in the vaccine readiness survey and in the vaccine rollout, addressing some of the issues why they are hesitating to be vaccinated. And these are our list of resources.
Just take,
Thank you.
I should just take 5 more minutes to wrap up. If there is anything else that you want to add, because it's so interesting.
I know, but I think if there are questions, we could focus on the questions. But just to give you an idea, these are the resources that we have right now. If you go to Pathways to Prosperity Canada, you will see there are video on cultural brokers, and you will also listen to some of our cultural brokers there. We did a shooting of some of their actual experiences in the area, including our, the food exchange program that's happening at the community level. We also have an evaluation of our broker model that's also here in this website. We did an impact evaluation of our older broker strategy. um, we also have a broker's toolkit in our website, Action Dignity website. If you go to our publications area, you will see there a toolkit that we developed as early as in 20, yeah, early years. This is not 2018, maybe 2012. And then we also have our anti-racism broker work. that we did as early as 2013. And we also have an evaluation and research on our scaling up our broker strategy. So